Excellent. Good afternoon, everyone. Welcome to today's presentation. My name is Baylor Rice. I am the owner and one of the pharmacists here at South River Compounding Pharmacy. So I'd like to welcome you to our webinar today on osteoarthritis and joint health. We do have a little poll going right now. I just asked a couple of questions to start some interaction today. So if you see that on your screen and want to answer that, I'll address those questions and answers in just a moment. A reminder, we are recording today's webinars. All webinars, for the most part, are put up on our YouTube channel, and that's located at YouTube at South River RX. And so you can watch those. Everyone should have received a copy of the handouts probably about half an hour or so before we started this morning. And you will receive afterwards. We'll send a copy of that out again, as well as a link to the recording once we have all that up and edited for you. You should also have a chat box in there. So if you have any questions, please feel free to ask questions as we go along. Just put that in the chat window there and I'll get to those. And with that, we're going to go ahead and get started today. So a couple of quick disclaimers. I don't send my slides off or have the FDA review anything prior to our presentations. They typically do not do that as well. Any compounds that we discuss also aren't approved prior by the FDA as well. So with that, we'll get into a quick about South River. For those that are new with us today, we do have, we were the first compounding only pharmacy in Virginia. My wife and I opened up South River back in May of '98. So we've been open a little over 23 years now, with really the vision of helping each and individual patient. So one patient at a time, helping you achieve your genetic potential. And so we do, and we're the first natural medicine pharmacy in Virginia. So we specialize in vitamins, minerals, herbals, homeopathics, etc. So within talking about joint health today, that's really where the herbals and vitamins and nutrition really comes in as we get into the pharmaceuticals really are lacking in that rebuilding and prevention stage. We also do personalized consultations. So certainly with regards to joint health, if you've got a complex history, if you've tried things, really have had a hard time, then maybe that is the best method for you, that we can really sit down and go over your history, your medications, your supplements, and put together a very precise protocol for you. As well, we've got a whole host of variety of different testing that's available and we can do. So anything we can do to try to look at things a little bit differently for you. Now, I want to give a quick disclaimer before we really get going this morning or afternoon now. I've got a lot of slides in this presentation. I went through and was thinking, okay, how much of this do I cut out? How much do we slice and dice? And really, we've got a very highly educated population we work with, which is fantastic. It makes things fun and exciting. And so I decided to go ahead and keep the slides in here. So I did want to kind of footnote that some of these slides I'll just be touching on really quickly. The reason why I left them is for those of you that like to dig a little bit deeper, like more references and research in there, I figured I'd leave that for you. So afterwards you can come back and dig a little bit deeper if you want to. So some of these I will just hit on for about 5 seconds and boom, on to the next slide. So just want you to realize that I'm not going to sit here and be reading slides, every word to you as we go through today. So first off, I did want to touch on magnesium just a little bit. And the reason why is because when we're talking about joints, you know, most of the time it's for two different issues, two main issues. One is for those of us that have been very active, where we've been using our bodies, and in my case, abusing my body, and really have had a lot of that pressure, right? So you hear my rings hitting together, and that's what we don't want. We don't want bone on bone, right? When that cartilage is totally gone, that's where we get bone on bone. That's where the pain, inflammation, everything comes from. So it's protecting that shock absorber, if you will. That cartilage is the trick. So helping to try to keep us out of pain, helping to keep inflammation at a minimum is really ideally there. So with that being said, so for those of us that are active, I want to kind of do a quick overview on this in the sense that magnesium is a very essential nutrient in the body. And it's responsible for more than 300 different pathways. It's affecting the cardiovascular system. It affects smooth muscle relaxation. So about 75% of Americans are deficient in magnesium. Now, with that being said, patients in pain, that number goes up to about 95%. So it's so very needed. So although not really rebuilding the joints, but when we think about the bones and the joints and the ligaments and everything, so for those muscles, for the ligaments, we really need that magnesium on board. So I felt like it needed some slides of its own and at least a shout out here in the beginning. So absolutely, most folks were really replacing anywhere from about 100 milligrams to about 600 milligrams, depending on your deficiency of magnesium a day. Now, of course, with bone health, and our bone presentation is going to be about in a month or two, absolutely critical for bone health. You need that magnesium, generally at about a 2-to-1 ratio of calcium to magnesium. And the poll is up. So I asked a couple of questions on that. Are you currently taking something for your joints? And it looks like about there were half the folks that responded said yes, half said no. Of those, are you satisfied? Only one person said yes, that they were satisfied with what they're currently using. And hence, I think that's really why you're probably on this today. So hopefully when we get done, you'll realize, okay, there are a lot of different tools in our tool bag we can use to help with our aging process. So let's go ahead and get into joint discomfort. And of that, certainly we've got a lot of different joints as we go through the body, right? So depending where that is, it's different for all of us. Me personally, my back, my hips, my knees, elbows, sometimes shoulders. Like I said, I have thoroughly abused my body. I personally have started taking stuff back in my mid 30s to help with my joints and help with the protection. And certainly it's still keeping me active today. So if we look at the amount of patients, amount of people really having issues, about 30% of the US adults reported having some sort of joint pain in the past 30 days. 18.1% of those of US men and 23.5% of women over 60 are reporting some sort of knee pain, and it's the leading cause of disability among US adults. That's pretty huge, right? So what can we do to help push that back? And that's what we're going to be talking about today. So more than 27 million Americans experience joint discomfort. 11 million Americans suffer from severe joint pain. Again, demographics on this, about 35% in women over 45, 26% in men over 50, 6% in men, women greater than 30 years old, 18% Black, 19% whites, 8% Hispanics, if you're curious on the demographics. So the trick here is, when can we stop this and what leads to damage? So a lot of times, we'll have an acute phase, have an acute issue, so there'll be discomfort and that'll kind of wane as we're taking something to help resolve it. And people will kind of get to this point of stopping with no more discomfort, but then next thing you know, the inflammation pops back up. So that's the key, really, as we're aging, as we're getting 35 and above, and as we keep ticking more years onto that time band, more need to help kind of keep that baseline at a better level. So if you look at chronic injury and joint discomfort, certainly as I was kind of using the descriptive with my hands, whoops, this is the piece that we're talking about here, right? So that cartilage, which we've got chondrocytes in it, this can be affected by aging, injury, genetics, all of these, diet, lifestyle play a role with this piece. Certainly, there's recruitment of inflammatory processes as we have damage and as we have injury. This increases certainly our tumor necrosis factors, our interleukin 1s and 6s. So those inflammatory processes, right? This activates our metalloproteases, so helping with that cartilage breakdown. And then you end up with chondrocyte death and cartilage loss. And then eventually, as that goes on, then you get that, right, bone on bone, severe pain. And once you hit that point, now in today's world, what happens is you end up getting joint replacements, right? So more of that bionic man and woman piece out there. So common medications used for joint discomfort these days, certainly acetaminophen. So brand name for that is Tylenol. Problem with that, hepatotoxicity, acute liver failure. You've got, depending on the year, anywhere from about 15 to 20,000 patients die every year of Tylenol toxicity. That's a lot of folks. NSAIDs, so your non-steroidal anti-inflammatories, your ibuprofens, Advils, Motrins, indomethacin, naproxen, Celebrex. The list goes on. A whole lot of NSAIDs in that category. Issue there, can eat a hole in the gut, right? So we'd have gastrointestinal toxicity, can lead to bleeding, ulcers, perforations, cardiovascular and cerebrovascular events, right? From myocardial infarction to heart failure, as well as stroke. As well, it affects the renal system, so our kidneys, right? And of course, when things get severe, you'll see some folks leading to the opioids. Of course, we know the opioid epidemic, or certainly in these days, the codeines, hydrocodones, morphines, etc. You've got the dependencies and the whole issues that go along with that. So that's where I said earlier, American medicine, we really don't have a whole lot of tools in the tool bag there, right? And what we have certainly has a catch-22, can help decrease some pain, help decrease some inflammation, but there is certainly a price to pay for that. So one of kind of level one, I kind of thought about how I want to word this to you today, and probably level one is glucosamine. So me personally, back in my mid-30s, started taking glucosamine. So glucosamine's been around a long time, certainly very well studied, very well researched, does help with the rebuilding of the cartilage and protection of the cartilage, right? So it is really helps with that cartilage matrix, helps with the synovial fluid, especially knees is probably the biggest area where we see the huge change with that piece. Typically, we're going to dose it at about 1,500 milligrams a day. You can dose it all at one time. You can break it down to 750 milligrams 2 times a day. But effective for moderate to severe osteoarthritis. Again, not just in the knees, but certainly in other joints as well. It's helping with overall. I call it level one because as we get into some of the research, we can see there are other agents that are available that have become useful and really better protection than glucosamine. So for the early stages or for the younger, that's where I say, okay, I'll bring in the glucosamine. Why? Relatively inexpensive. And the best form is sulfate. Right, sulfate form of glucosamine is much more efficient than the hydrochloride form. So that's the form that we want when we're doing glucosamine. Probably really to step that up would be one called joint complex. So joint complex is a novel combination of type 2 collagen, and it has a hops extract called thea, which is tetrahydroisoalpha acids. So very specialized hops extract that does an amazing job of decreasing inflammation. So it's really kind of a 1-2 punch. It hits not only for the cartilage and the joints, but it's also helping to decrease that inflammatory response and process at the same time. So it hits on both sides of the fence. So some advantages in looking at some of the data and studies of the type 2 collagen protein versus glucosamine, and even using glucosamine with chondroitin, you can see much better response in a variety of really marking points and scores of patient symptoms where the type 2 collagen is doing much better. And you can look at really versus placebo, type 2 collagen as far as amount of change. So certainly as time goes on, there's a bigger delta there. So certainly helping with that knee extension, helping with overall decreasing discomfort and decreasing inflammation and helping with range of motion. Also been shown to help with lengthening the time of strenuous exertion without discomfort. And, got a picture of a runner here, and it's a great cardiovascular workout. I used to enjoy running myself, but right now I don't, I'll do some minor jogging, but really most of my cardio I get from riding bicycles from the aspect of much easier on my joints. It's not that pounding. So if we look at a couple of different things, and this is certainly where we'll kind of go through, again, helping with prostaglandin inhibiting aspect of that hops extract, certainly helping to reduce that inflammatory process. Really assessed by a number of different scores, right? Not just one aspect, not just one medical symptom questionnaire, but a whole variety of indexes and looking at things differently, really showing quite a difference in that piece. So you can see as time goes on, certainly we have a further decrease in joint and muscle complaints. And overall, you can see this 58% decreasing. And the key there, I do want to point out, no significant GI symptoms. Versus the NSAIDs, that's one of the key things that we'll see with those non-steroidal anti-inflammatory drug classes, right? So again, a lot of different ways to look at this, a lot of different scores. The key here is all of them are showing very similar data, right? Improvement, improvement, improvement. And that's what you want to see. You want to see similar data in a variety of different studies, and different studies looking at things differently. So it does work and is very effective. As far as looking at analgesic use, this was interesting. In this study, 10 of the 13 patients were using analgesics for joint pain at baseline. At 12 weeks, only 3 of those patients were using analgesics, and one of them one of those had reduced their analgesic dosage overall. Well tolerated, no serious side effects. Again, just looking at the comparative data again with the gold standard that's been out there for so many years, glucosamine, certainly really looking at respectively 33 and 40% decrease compared to 14 and 15% reduction. So even better reduction and improvement in overall health and quality over time. So joint complex is what we have called this to make it nice and simple. So very effective relief at just 2 tablets a day. Typically, I will break that up and do 1 tablet twice a day for ease of use. Okay. So that's honestly my favorite. That's my go-to. That's what personally I transition to, just because once you kind of hit that 50 mark, the game kind of changes a little bit, right, as we continue to get a little older. So if we think about inflammation, and certainly the joint complex hits both, again, inflammation as well as the cartilage piece, but there's a lot of folks that, okay, wait a second, we really need to hit the inflammation harder, or, I'm doing okay with the cartilage with just straight glucosamine. What can I add in addition to that? So Inflavonoid Plus is a formulation that is a combination product. So there is curcumin in here, and it is the branded curcumin, and it's also a flavonoid, xanthomol. So they're again a promatrix thing, and we've got a hops extract in here. There's some boswellia as well as ginger. So hitting inflammation from a variety of different points. So very positive outcomes, helping with that oxidative stress at the cellular level. And one thing I want to point out here with this slide, this compares curcumin, which is the branded product, to a standard normal kind of curcumin extract. So I'll have a lot of patients come in and say, well, I'm taking curcumin and maybe, although I read lots of data on it, Baylor, what do I do? There again, quality matters. Absolutely, quality matters. So if you can look at really what we get absorption wise and what a difference it makes versus your standard powdered extract, quite a difference. Absolutely quite a difference. Again, xanthomol helping with decrease in inflammation. Ginger and boswellia, again, herbs that have been around for centuries, right? Helping to decrease that inflammation, also helping with immune function, both of those as well, which is fantastic. Here's the actual breakdown of it. So you've got per 2 capsules, 250 milligrams of the curcumin, of the hops extract, 250 milligrams, 206 milligrams of boswellia, 100 milligrams of ginger. So a nice therapeutic benefit of each one of those. Typical dose that I'll do for somebody in Baylor, I'm inflamed, I've got an injury, I've got something going on. Typically, I'll do 2 caps twice a day. Now, certainly, as you improve and decrease and inflammation gets better and have better range of motion, etc., then certainly you can decrease that. Some patients may get away with, after I've got things under control, I'd take 1 a day just from a preventative standpoint. Absolutely fine. Okay. Questions a lot of times are, how do we get really resolution of the inflammatory process? And there's something called SPMs, which are specialized resolving modulators. So that's helping to decrease, really, and helping to resolve that whole inflammatory process. And, a couple of months ago, we had a webinar on inflammation in general. So if you want to dive further, certainly I'm touching on that some today, but if you want to dive further into inflammation, you can go to our YouTube channel and pull that up, or send us an email and we can send you a link to that as well. So it's really resolving that inflammation over time, and helping to settle that whole inflammatory process down, right? We've got a trigger, we've got inflammation. We don't want inflammation over time to stay up there. That's where damage happens from tissue and cartilage. Overall, the more inflammation we have, ultimately, the sooner we die, right? When you peel back and take this a step further, number one killer for humans in the US is cardiovascular disease outside of COVID time. So look behind cardiovascular disease. What's there? Inflammation. Look behind diabetes. Inflammation. Alzheimer's and dementia. Inflammation of the brain. Inflammation's what gets us. We've got to get that under control. Okay, so we really have to resolve this, get this whole inflammatory process squelched and settled down. Okay, so SPMs, ultimately, they're helping with that inflammatory process. They modulate the inflammasome. So you may have heard of inflammasome. with Fauci and some of the other folks talking. I know you've heard me talk about it on my COVID webinars and presentations. The inflammasome is what's going on and affecting the inflammatory process with the SARS-2 COVID issue that we're still fighting right now. So overall, helping to reduce the pro-inflammatory cytokine production, helping with tissue repair, helping to remove those dead neutrophils and cellular debris by the macrophages, and terminating the neutrophil influx to affected tissue. So what's kind of neat about SPMs, it's hitting a number of different areas. So will I use that in combination with the curcumin and flavonoid complex? Yes. Will I use it in combination with CBD? Yes. Why? They're all kind of hitting at a little bit different spot. So one's kind of upstream, one's downstream, right? So if we can hit inflammation a variety of areas, then we're going to break through it much better. So ultimately, what it means, SPMs may prevent excessive inflammation by breaking the inflammasome activation chain reaction and promoting inflammation resolution without suppressing the immune system and immune function, right? There again, you have a chronic inflamed patient, and if the NSAIDs aren't doing it, American medicine, what do they reach to? Reach to prednisone, right? Steroids. Problem with that, huge effect on the liver, right? So very hepatotoxic, suppresses immune function, suppresses bone, and affects bone growth. So chronic prednisone use, certainly we'll see osteoporosis, not osteoarthritis. We'll see that as well, but also osteoporosis, the bone thinning, right? So we try to avoid those steroids as much as we can. Interesting thing here with obesity, anyone that's heard me speak before, I'm a big fan of losing any fat we can, right? The more fat we carry, the more inflammation we're going to have. The more inflammation, the more fat we carry, the faster we die. End of story. That may sound really kind of harsh and black and white, but the data is there. So even pulling 5 pounds off, I take serious, right? I'll have patients that want to lose 150 pounds. I'll have patients that want to lose 5 pounds. I take the 5 pounds just as serious as 150 because that extra 5 pounds, that person shouldn't be carrying away, right? It's increasing inflammation. So SPMs, really what's interesting when you look at that ratio of SPMs and pro-inflammatory markers, it's lower in obese adipose tissue, meaning you don't have as many endogenous SPMs with the increased fat. Side note, I wonder if this is in part what's affecting part of the folks with obesity and people with chronic disease having a more severe reaction to the COVID virus. Theory postulated. So SPM's active. This is what it looks like. If you're sick, chronic pain, injured, SPMs are going to help you get there faster, right? Anywhere from 1 to 6. I know that's a huge dosage range. So, I'll share with you, almost 2 years ago, I've got 2 big dogs, 2 big Newfies. I walk them all very frequently. I was coming across Monument and they saw another dog. They took off. So I've got 300 pounds of dogs and I had on some slick boots and I'm just literally water skiing across Monument. My toe caught the cobblestone. I go down, tore my meniscus, did a number of other damages at the same time. So at that point, certainly I'm hitting it with everything I can because I don't want to have surgery. And I certainly don't want to end up with a replacement. So I was hitting the SPMs 2-3 times a day. I was certainly doing the joint complex. I was adding extra inflavonoid intensive care, and then, or rather the inflavonoid plus, and then of course CBD on top of that. I hit it hard, and then as I got better, certainly I was backing down, right? Hit it hard initially, knock down the inflammation, help with the repair process. So I do want to take a few minutes and speak of cannabinoids, okay? Now, certainly with that being said, again, We do have a cannabinoid webinar on YouTube. If you want to get more information on that, I am sorry, I did not mean to fast forward that quick. If you want to get some more information, certainly go to our YouTube channel and you can watch a whole hour on cannabinoids. But I wanted to at least hit a little bit of the research for you quickly, just so you can understand from an inflammatory process, right? So with that osteoarthritis, we've got inflammation, we've got pain, we need to get it under control. Whatever we can do to keep you away from opioids is a good thing. Tough on the liver, tough on the renal system, addictive potential, affects the bowel, affects the immune system. Used here and there post-surgical, absolutely get it, understand it. But from a long-term chronic use, a whole host of problems and complications, right? It definitely does not help with the healing process. And I think people that are having joint replacements and that sort of thing are finding out more and more. Most prescribers are really prescribing fewer and fewer opioids and a much smaller quantity and trying to get you up, active, mobile after replacement much faster. So cannabinoids, that's really the chemical behind in the cannabis plant that holds the secret. So, in the cannabis plant, you've got two sisters. You've got the marijuana plant, which is going to be high in THC, and then you have the hemp plant. So the hemp plant is high in CBD and very low in THC. So it's a THC that's the compound in marijuana that elicits the high. That's what gets you stoned. It's certainly highly regulated, federally illegal. It does have some therapeutic beneficial benefits, but certainly what it can do is induce psychosis and anxiety, hepatotoxicity, have some additional drug interactions. Whereas CBD is available over the counter, it is federally legal, it's not going to get you high, it's not psychoactive, it doesn't induce that psychosis and increase the anxiety piece. It is anti-inflammatory, helps with pain, helps with immunomodulation, anxiety, depression, sleep. The list goes on and on. It has been a game changer for me, for my patients. And part of the reason why is we're hitting over about 220 different receptors from head to toe in both the CB1 and CB2 receptors. So it is helping with homeostasis in a variety of different systems within our body. So it is something we have endogenously. We have endogenously in us 2-AG as well as anandamide. So what happens over time and due to exposure to chemicals and toxins in our diet and our oxidative stress with the environment, we're decreasing our endogenous cannabinoids. So therefore, we need to replace them and fill the gas tank up, right? A couple of the things out there, certainly increased expression can be beneficial in certain disease states such as neuropathic pain and multiple sclerosis by decreasing symptoms and even slowing disease progression. A statement from the NIH, National Institutes of Health, modulating the endocannabinoid system may have therapeutic potential in almost all diseases affecting humans. Absolutely huge. Don't be scared of CBD. Don't think, well, gee, it's pot. No, it's not pot. It's not high in THC if you know what you're getting, right? Can you go online and play Dr. Google and get something online that may not be what it's labeled and may not be what you think? Absolutely. That's why I'm very picky about the companies I deal with, very picky about the quality, the testing, the whole 9 yards, so you get the right product and you don't get something that we don't want you to have. This is by Dr. Raphael Mechoulam. He's a chemist who identified the endocannabinoid system. And what he said, this is, quote, "I can't list all the physiological systems and conditions affected by cannabinoids because there are too many." Folks, that's huge. Absolutely huge. This is a guy that's identified the endocannabinoid system. Brilliant man. This is why these statements, and this statement by the World Health Organization on CBD. CBD is safe and well tolerated in humans, not associated with negative public health effects, not associated with abuse potential. These 3 slides are the really big reason why I've incorporated it in what I call my baseline protocol. Go back. What have I said? Inflammation is what kills us, folks. If we can decrease inflammation, we can support and balance a system. You're going to move your bar higher and you're going to push back long-term disease. So let me postulate this. Let me plant this seed for you as well. So for me, I tore the heck out of myself about 2 years ago. My knee's doing quite well. I haven't had a replacement, didn't take steroids, didn't take narcotics. I took what I wrote down on the screen for you. Now, since, I still take these things at much lower doses. If you think about the progression in American medicine and what science figures out on a daily, weekly, monthly, yearly, decade basis, the further we can push back a major surgery, the better. Meaning, think back 20 years ago, joint replacements versus joint replacements today, right? If we live long enough, if we are hard enough on our body, odds are we're going to probably have to replace a joint here or there. Get it? Got to understand. Hopefully not if we've been doing the right things and protecting ourselves, okay? But if you haven't, odds are stacked against you to where if you don't do the right things, odds are high you're going to have to replace something. Think about the replacement today versus 20 years ago. The replacements today, the recovery is so much faster. Technology has increased so much and they're lasting longer. Those that had them 20 years ago, they probably have already had that replacement replaced once or twice already, right? So just think if you can push it back 5 years, push it back 10 years, what that's doing long term with other future surgeries and replacements, right? So that goes back to Mesmer back in the 1700s, Chinese proverb, an ounce of prevention's worth a pound of cure. The sooner we do something, the better off we are. Okay. So more on cannabinoids. Again, very busy slide, but look at all the different areas this is hitting, right? And it's not just like you use CBD as terminology. That is kind of where the industry is. The industry uses CBD as a quick an acronym for cannabinoids. However, cannabinoids really include, there's over 115 different cannabinoids. CBG, CBC, CBD, CBDA, CBN, the list goes on. All of these different things can have a little bit different effect, right? Look at CBC, helps with bone density. So, CBG also helps with bone density. So, inflammation, right? When we think about from an anti-inflammatory process, we've got a number of the cannabinoids hit the inflammatory process and at a variety of different levels. So that's why I really wanted to kind of take and highlight CBD a little bit with its own few slides, just so you can kind of really get the gravity and grasp of the impact it's having on the human body. Pretty huge. As I mentioned, about overall 80% of the stuff on the market is not what they claim. And that's been true for herbals and stuff for years. And that number is still the same today for overall supplements. 80% of what's out there is not what they claim on the label. That's why I really spend a lot of time vetting the companies we deal with at South River, dealing with companies that are GMP certified, registered with the FDA, following good manufacturing practices, doing dissolution, disintegration, mass spectroscopy, liquid chromatography, so you get what you're paying for. And you also don't get what we don't want, right? We don't want the heavy metals. We don't want the pesticides. We don't want to help decrease inflammation, but yet add heavy metals on the same side, which is deposited in the brain and affecting Alzheimer's and dementia and chronic disease and autoimmune and everything else, right? We don't want to do harm while we're trying to do good. Dosing on CBD. Certainly my staff is very well educated, but I did want to include a slide on this for you so you had some sort of concept. Typically, so for instance, me, when I did my knee, right, I was doing it orally, but I was also using a topical salve on my knee right at the area. Now I had to be careful initially because, I could barely touch my knee without feeling like I had an ice pick in it. But around the area where I could, I'd apply the salve. On my shoulder, certainly got torn up, as well as my hips a little bit too. So the topical was doing good, but I was doing the tincture, right? You can also do gummies or oral soft gels. It doesn't matter how you get it in orally with our Boxley's Organic. It's all exactly what it is on the label. So, if you like tinctures, great. If you'd rather do a gummy, if you'd rather do a soft gel and not worry about the other, absolutely fine. However we do it though, I generally start with somewhere around 15, 20 milligrams a day and increase the dosage up until we get the desired effect. How you know you've dosed it too high, if you start getting some daytime sleepiness, then that's where I start backing off. Okay. And then we start decreasing the dose. So for me with my knee, my typical patients, and I don't mind sharing stories with myself because my staff will tell you and all my patients know I practice what I preach. Absolutely. Um, so I don't mind sharing self stories with you. So my normal daily dose of CBD personally is about 30 milligrams a day. When I tore up my knee, I cranked it up to 80 milligrams pretty darn quick. And that's where I was for a couple of months. And then I started titrating that back down. And now I'm back down to 30 milligrams a day. This is kind of my baseline for overall health protection, right? I've got some family history of Parkinson's in my family. We've got some cardiovascular disease in the family. So I want to protect my brain. I want to protect my heart. Everyone knows I use this descriptor all the time. I go like a banshee. I don't stop. I work hard. I play hard. I want my bar high, elevated, and then one day, boom, just drop dead and be gone. I want that later rather than sooner. But personally, I love the water. I love getting out on the water. So I'm a big boat guy. I will not let any of my kids, and I've got teenagers and I've got 20-year-olds. So any of their kids do anything behind the boat, I will not be outdone behind the boat. I can take anybody down doing any sport behind the boat. So I want to be able to do that into my 70s and 80s. So that's why I keep this on for an overall and then topically, using a salve, using a cream for the areas, the injury areas that we need to. Okay. Pets, certainly we've got pet treats as well. Nice, tasty beef chews. So what else can we do, right? Lifestyle wise, don't want to ignore that. Fruits, veggies, good fat. We need to be having 4 servings of good fat a day. Those that are, 40 and over, really 50 and over, really once you hit 50, you need to be having at least 30 grams of fiber a day. Most folks I see aren't doing that. We need to limit our salt, our caffeine, excessive alcohol, limiting that white flour, white sugar. Especially if you've got inflammation, I would very much consider going gluten-free. Okay. Gluten typically helps to increase that whole inflammatory cascade issue. Sugar increases inflammation, folks. Absolutely. Exercise. Those that follow and watch frequent will know, it wasn't too long ago. This used to be 150 minutes in my presentations. Some recent data came out that showed for males, the study happened to look at males, sorry, females, but I flip it to females as well. All right. This study just happened to look at males 45 and over and what they needed for help with cardiovascular health. So helping to lower cholesterol, helping to lower blood pressure, lower cardiovascular markers, 300 minutes of elevated heart rate a week. Okay. So it was 150. Now that's 300 minutes we need a week of cardio. Do pull in, 2 days a week, 3 if you want to, weight bearing, daily stretching. Okay. We need to stay active. We need to move. Case in point, what do they do after surgeries? They get you up out of bed moving. They get you doing PT. 20 years ago, sit in bed for a couple of weeks, let things kind of heal up, right? Mentality has changed. the blood stagnant, increase inflammation. We need to get it moving. We need to get the blood moving. Getting that blood moving is going to help clear out the inflammation and help with the healing process. 8 hours of straight sleep a day, right? That's where our adrenals are going to recharge. That's where our batteries are going to kind of reset and get us ready to take on the next day. Relaxing, breathing deep, doing that often. So very, very important. And also, side note, for those with certainly allergies and sensitivities, I kind of call it more food sensitivities versus allergies. Allergies, certainly, peanuts or different things like that. I can't breathe, right? Sensitivities, you may not test necessarily positive, but you're still having an inflammatory reaction to things. So, we do have anti-inflammatory diets at the pharmacy. We can email you a copy. You can stop by, pick it up, talk to one of the staff. If you need help working through that, certainly you can set up a consultation with either myself or Rhonda, and we can help walk you through and guide you how to do that, what to do, work up some menu plans, etc. So an anti-inflammatory diet can be very beneficial, especially for chronic disease, autoimmune disease. Side note, and if you have an autoimmune disease, there's 105 different autoimmune diseases in the US. You definitely need to be gluten-free. Absolutely, without a shadow of a doubt. So, my baseline supplements. People ask, Baylor, what do you take a day? Share with us what you take a day. Absolutely. Well, my thing contains much more than this, quite honestly. My pill case, I've got one I do every morning and every night. I fill it up on Sundays, ready for the week. So I've kind of pared this down to, what are the top 4 things that absolutely baseline, I wouldn't cut it beyond that. So number 1, phytonutrient multi. It is a food-based multi, very rich in antioxidants. Why is that important? It has the serving 2 tablets is going to be the equivalent of about 9 fruits and veggies as far as antioxidant potential. So it's protecting our cellular DNA. So if you think about it, 65% of genetics is modifiable. That's a very deep thought. I will repeat myself. 65% of genetics is modifiable. That means, let's say you're encoded for a disease with your genetics. If you eat the same, exercise the same, do the same thing your ancestors did, and the way you're genetically encoded, then you're going to get that disease if you live long enough. However, what did I just say? 65% of genetics is modifiable. If you're a Vegas guy, that's better than the house. Okay, that's more than half. You've got a chance to change the expression of your genetics. How do you do that? With everything we've talked about today, right? Eating well, exercising, staying active, decreasing stress, right? Having the right nutrients on board, having the antioxidants help protect the cellular DNA. Also contains methylated B vitamins. Methylated Bs, 50% of the population has what's called an MTHFR deficiency. That's where you're not methylating the B12 and folic acid properly. And when those patients, we see an increase in cardiovascular disease and an increase in neurological disease. So I put all my patients on methylated Bs because I cover my bet on that. Omega-3 essential fatty acids. Good for everything head to toe. Guess what? They're also anti-inflammatory, right? Also helps with dryness, helps one side of the brain talking to the other. We want at least 2,000 milligrams a day if you've got history or got stuff going on. That's why I kind of have a range here. We'd certainly hit that higher. Our 1,000 milligram fish oil is not 1,000 milligrams of fish oil. It's actually 1,000 milligrams of EPA and DHA. That is the chemical constituent in fish oil. That's the active ingredient. So we call ours by the active ingredient, not just by fish oil, because you could have 1,000 milligram fish oil with only 300 milligrams of active ingredient in that. So you'd take 3 1/3 of those to equal one of ours, which is pretty typical of what we find. Most of the ones out on the market space have 300 milligrams or less. Or if you prefer, Baylor, I don't want to do a soft gel. I'd rather do a liquid. This is very clean. It does not have a fishy taste to it. It's 2,400 milligrams per teaspoon. So 1 to 2 teaspoons a day. If you're doing a smoothie or something, add it to the smoothie. Vitamin D3. D3, my baseline is 5,000 IUs. We've got it with and without K2. Ideally, I put you on it with K2 because K2 helps keeping the calcium going into the bones where it needs to go versus into the smooth muscle and hitting the arteries or depositing in the brain. I want it in the bones. So K2 helps with getting the calcium and D to the right spots. I will go much higher than 5,000 if we have labs. If we don't have a lab, though, I stay at 5,000. And then, as I said, CBD, whether you do the tinctures, the capsules, the gummies, and then, plus or minus, certainly the salve. Now, you'll notice, I mean, this is mine. You notice the jar lid is broken here, so it is in a glass jar and it will withstand, at least mine did, falling on a tile floor in the bathroom. The only thing I did was crack my lid a little bit. But I don't travel without it. Other supplements. So this is kind of a review of what we've gone over earlier. So I started with magnesium, right? Typically, most of my patients, somewhere between 200 to 400 milligrams of magnesium a day. We can do it as a powder. We can do it as a tablet. We can do it as a capsule. Either way, however you want to do it. We also have it with malic acid in it as well. I designed that formulation for our fibro patients, which is why I called it fibro support. So it's a combination of both magnesium glycinate and magnesium and malic acid. So, if you're having those tender points, right, that's wonderful. You'll notice I have, again, a range, right? And magnesium glycinate, that's my preferred form, much better absorbed, and it's much easier on the gut than your other forms of magnesium. But still work it up. If you do notice that the bowels get loose, then we back down on the dose. So for joint health, you'll notice here I kind of listed these level 1, 2, 3. Glucosamine sulfate. So again, if you're young, active, let's go ahead and get some glucosamine sulfate on board to protect it so we don't have issues down the road, right? 750 milligrams twice a day. If you're already starting to have a little bit of discomfort or whatever, maybe we up that a little bit to the triple joint. Triple joint adds in some chondroitin sulfate. It also has MSM, which is methyl sulfonylmethane. 2 capsules twice a day on that formula. Or we can pop it up to the advanced joint support, which has the MSM, green lipid muscle extract, glucosamine sulfate, has some chondroitin sulfate, and then also the hyaluronic acid does a very nice job. So I was doing actually the advanced joint before our joint complex became available. So, kind of level 1, 2, 3. And again, from there, you'll notice the Regenerage and also the joint complex. So what's the difference in those? Regenerage is a collagen, chondroitin, hyaluronic acid, red wine, grapeseed extract. So it does a good job for the joints. So if you're not really having any inflammation, but worried about the joints, okay? Now, for the females on today, what else does it do? Help decrease fine lines and wrinkles. It's not only helping with the joints, it's helping with the bones. It also helps with the skin. Can we also see a difference if we're increasing collagen? Right? If we help with collagen formation, that's going to help with elasticity. Our skin, but also for the vaginal tissue, we can see a difference there too. So 3 capsules a day. And that's why I kind of put, you can pull that in level 1, 2, 3. But again, that's going to have some skin help there too. And then, of course, joint complex, which we spent some time on today. Again, that's helping the joints, but also has the inflammatory component built in with that. So, if you're already, wow, I've got some joint issues and I've got some discomfort, then bam, I'd start there. We get things under control. Then you can kind of back off if you want to. Other things used for inflammation, Ultra Inflamax is a medical food that does have ginger and curcuma root, hops extract, micronutrients, macronutrients, amino acids. It is an amazing medical food. Amazing. It is the first thing I put all of my rheumatoid arthritis patients on, which is a severe inflammatory process immune disease. works amazing. It will lower the SED rate. It will lower C-reactive protein every single time. So if it's, well, depending how severe you are, right? And depending some patients, well, I'm doing a bunch of tablets, capsules here. Let me do something a little bit different. Again, that is in shake form. And Flavonoid Plus, certainly we went over that in depth today. Anywhere 1 to 2 capsules twice a day. Really severe injury, we could always increase that to 2-3 times a day for a brief period to get things under control and back down. If you're not on CBD, adding the CBD, or if you're on CBD and still having some discomfort, cranking that dosage up until we get to where we need to be. And then, of course, kind of plus or minus topically as needed. Again, I mentioned the salve. I've also got the sports cream. And of course, I'm kind of like a kid in a candy store. I've got everything at home. But the between the sports cream and the salve, but the salve's probably the first go-to because it is the most concentrated. So it is going to have the most milligrams per gram in it of CBD. It is, you can see, it's like a stiff paste, almost kind of not quite waxy, but it is very stiff. It is a salve. It is kind of an ointment base. Put your finger in that, melt it a little bit. So as you kind of get it melted, a little does go a long way. Okay. So you don't need a big teaspoon of it to cover. Lord knows a teaspoon would probably cover half your body at one time, probably the whole body, depending on how big you are. So what's next? Certainly, as I mentioned, let's get on some baseline supplements. Baseline supplements, good for everybody, and that's why I kind of call them baseline. What should we do? Like foundation to our house. We need a solid foundation. This is the only body we've got. We need to protect it. Granted, we can replace joints and this sort of thing, but the more we can avoid that, the better we are long term. I truly believe. Stop in. We can do curbside pickup. You can order online. If you've got some inflammation going on, then certainly we can add something for that. If you're active and or older, and let's do something to protect the joints. Depending where you are, severity or how hard you've been on yourself is kind of depending there again. Where we start with which one. Is there any harm in starting heavier? No, absolutely not. I kind of put that at level 1. Why? That's the least expensive. So where I can try to save you some money, I can, but it doesn't do any good to just do that if we need to hit it harder because you're having pain and discomfort. Now, mind you, also, you need to give it time. Okay. Anything we do for the joints to try to help with the cartilage, you need to give it at least 90 days. Where we'll see very frequently, though, with that being said, with the joint complex and also with the advanced joint, most of the time I'll start seeing a difference in 30 days. We won't be plateaued. You won't fully be there, but most of my patients will start seeing a difference and come and go, holy smokes, can I be seeing it this early? Yeah, absolutely. See it very frequently. But you still need to give it time, and then certainly we can back down. If you want to schedule a consultation, if you want to get further in depth, if you really want it personalized, and or if you got a very complex history and want to, okay, I want you to go over all of my labs and my medications and everything else and help me, give Allison a call. She is our patient care coordinator. You can send her an email. She'll get back with you. We do our consults via phone, WebEx, Zoom. For our older folks, we are still doing some in person, and so we are gravitating towards that. We do ask. I have been vaccinated. Most of my staff has been vaccinated. I do think it's a personal decision. I know that's probably coming next up in the question link. But for in person, typically we are wanting you to be vaccinated. Since we're vaccinated, then that way that risk factor goes down. I'm trying to be careful. I'm trying to protect my staff as well as our patients. Here's just a brief list of some of the recorded webinars. In the PDF, I think these have hot links in it, so that should take you right there. This isn't everything we have. We have lots more than this. Some of it we can't have open sourced. We need you to send us a request, and then we'll send you a link to it. And a lot of that's for our weight loss stuff, GI stuff, detox webinars, those in particular. just pop us an email saying, hey, I want to see that. And we're working on a list overall on our website so you can have the full list and know what's up on YouTube and also know what's kind of on YouTube but hidden behind. Okay. So questions. I know we had a question come up through there. Go ahead and type in your questions. Happy to answer anything you have today. While we're waiting for those to come in, I will remind you to, give us a like on the various social media channels, whatever's your favorite. We're out there on YouTube and Instagram, Twitter, Facebook. Give us a review if you will. That'd be fantastic. We'd appreciate that. Sign up for our email newsletter if you haven't done that yet. We do not sell your information. We won't spam you. We really just send out reminders for the webinars, send out information, as well as use it quick information. For instance, if our phone system's down or we've got to close early for inclement weather or something like that, it's quick and easy to reach out to everybody. All right, folks. Well, I don't see any other questions coming in, so we will call it for today. Certainly, if something else comes up afterwards or watching on, for those of you that are watching this on YouTube, certainly give us a like, subscribe to our channel. You can email in questions and we'll be happy to get back to you, or stop by the pharmacy or give us a call. We're here to help. Thank you so much, and I hope everybody has a wonderful day. Bye-bye.